Hi, my name is Dee Eaton. I'm the Senior Clinical Editor at Nursing Times. In this video series, we've discussed the fundamentals of support surfaces and what they aim to achieve, plus we've provided a detailed overview of all the different technology types. In video 1, we looked at the fundamental science behind support surfaces and what causes skin damage. In video 2, we looked at static support surfaces, foam, hybrid and semi-dynamic systems. Video 3 explored dynamic therapy mattresses and video 4 covered fluid immersion and air fluidized systems. At every step, we have placed emphasis on individualized patient care when it comes to selecting the right product for the right patient at the right time. In this, our final video in this series, we're going to focus on those patients that may need further assessment and consideration, paediatrics and plus-size patients. In addition, we will also consider other aspects of support surfaces, such as cushions and chairs. When we think about support surfaces, we tend to think about mattresses and specialist beds. Indeed, there tends to be a lot of focus and attention paid to the product prescription for bed and mattresses. But the term support surface is an umbrella term that covers anything a patient is sitting or lying on, including cushions and chairs too. When a patient is sat out of bed, it might be easy to forget about their skin integrity. Do we pay sufficient attention to the specification of the chair cushion they're sitting on? Ask yourself, are you familiar with the range of therapeutic seat cushions that can be placed on top of a chair to support patients when they're sat out? International guidelines advise us to select a seat and seating support surface that meets the individual's need for pressure redistribution. They say we should pay consideration to body size and configuration, effects of posture and deformity on pressure distribution, and mobility and lifestyle needs. When patients are in a seated position, it only takes a small amount of pressure to lead to the development of pressure ulcers. Studies have shown this can happen as quickly as within 1 to 2 hours. This is due to the patient's entire body weight being redistributed to a small area, resulting in higher pressures. If a patient is sitting out for long periods of time, an assessment must be carried out to review the specification of the chair. Wheelchair users and the specification of a cushion on a wheelchair should also be considered. However, this is usually an incredibly specialist area and one that should be consulted using specialist teams such as wheelchair services or occupational therapists. A standard bedside chair usually has a foam base, therefore offers limited therapy. If the patient is deemed to be at high risk for pressure ulcers, it will be worth considering adding an additional cushion to support with increased immersion properties. These typically contain foam or gel. However, if a patient is at greater risk, your care facility may have access to a dynamic seat cushion. These work like a dynamic mattress in that they are fed with a constant supply of air via a plug-in control unit. They fit directly onto any standard hospital chair and usually have an anti-slip base to secure them. Some of these cushions share the same control unit as a dynamic mattress, meaning a user would need a dynamic mattress to use a dynamic cushion. But more advanced systems have their own control units which provide greater flexibility. When selecting a seat cushion, it's important to factor in the overall seat height. If the seat is at the wrong height, a patient will struggle to mobilise. Too low, and they will struggle to lift themselves off the chair and feel like they are falling when they sit down. But if the chair is too high when they are seated, their limbs will hang and put too much pressure on their lower back, and when they go to stand, their feet may not safely touch the ground, making the move a dangerous one. The height of the chair from its base to seat height should match the popliteal height of the patient. This means the measurement from the base of their foot to the back of their knee should match the height of the chair from its base to the top of its seat. An easy way to test this is to see if the seated patient can comfortably put their flattened feet on the floor with the upper legs at 90 degrees to their calves. Obviously, if you're adding a cushion to your chair, this could add extra height unless the original base is removable. Cushions vary in height between 5 to 10 centimetres, so it's advisable to measure up first so that you get an appropriate cushion depth to achieve popliteal height. So you may need to adjust the cushion padding or chair height to achieve the popliteal height. Patients with mobilisation challenges may benefit from a riser recliner or tilt-in space chair. Both of these therapy chairs can assist with getting patients from a sitting to a standing position. A tilt-in space chair, in particular, is a therapeutic device that aids pressure redistribution. It allows the user to tilt the entire chair back while maintaining the same angle between the backrest and seat, the chair position. This means that gravity does a lot of the work and pressure offloading can be achieved. Now I'm joined by Deborah Wickens, Lead Tissue Viability Nurse for Barking, Havering and Redbridge University Hospitals NHS Trust. So can you tell us what factors are important when considering a specialised chair?
So there are a number of factors that we need to consider when we're thinking about the right seating surface for a patient. We're thinking about things like the patient's age, their weight, for instance, and we might be able to use higher specification cushions in some cases where risk is higher, that fit the patient's morphology and needs. So we can get gel cushions, cushions with foam, air cushions, and we can work with other professionals in order to find the surface on the chair that's right for the patient's specific needs.
While there is a lot of focus on pressure ulcer prevention and treatment in adults, there are limited products available that have been tailored specifically for paediatric and neonatal patients. Indeed, few manufacturers acknowledge the clinical challenges around maintaining skin integrity in this vulnerable group of patients. But children and babies are at high risk of pressure damage due to the vulnerability of their skin. To get the paediatric perspective, I caught up with Rachel Alloway over Zoom. So Rachel, when might we need to pay attention to viability of the skin in a neonate or child?
When a child or neonate is critically unwell, we need to pay particular attention to their skin integrity. There's certain risks that are involved if they were to get a breakdown of the skin, such as infection, and we can't ignore that risk. And there's real challenges involved when we're looking after smaller patients like neonates and paediatrics, which make them, at particular risk for this kind of damage. If we think about their mobilisation, if they're on high levels of sedation and inotropes, for example, that's going to be putting their skin at higher risk. You're not going to be able to make those changes in position for your patient that you would normally. And they also have a really vulnerable occiput. So that head is quite disproportionate in comparison to the rest of their body.
What should I consider when selecting a support surface for a neonate paediatric patient? Is it okay to use an adult mattress?
Ideally, we wouldn't be using adult products for paediatric patients. Normally, if we think about neonates and infants, those patients are going to be being nursed in an incubator or a baby therm or a cot, for example. And actually, we should be using a specialist mattress that will fit that piece of equipment. Also, adult mattresses, they're not really appropriate as they often have a minimum patient weight limit that's actually too high for a small paediatric patient. And we need to make sure that if you're using an adult mattress, that it has no minimum weight limit for a paediatric patient.
So how can we help this particular group of patients?
Well, even though there is a very narrow choice, we need to be aware that there are products available for these sorts of patients. So there are specialist mattresses for infant warmers and incubators that you can get, and also specialist air mattresses that you can get for cots. These products, they shouldn't just be a smaller version of an adult mattress, but they need to have special features that are specially designed for this particular patient group. And as clinicians, we have a real role to play to make sure that we've got supply of products for this specialist group of patients, and that all of those specifications are factored in for them. We know that there's some special neonatal mattresses that you can use in incubators and infant warmers. And some of them are even able to simulate sort of a womb environment. So they might have a padded inner circle or a specialist ring for positioning. And it really cradles around the baby to give them that security and support that they need. And it really helps with their positioning. There are some specialist air mattresses as well that are suitable for cots, and these sorts of ones, they have specialist smaller cells that accommodate that smaller profile, and they should also be appropriate for that lower weight of your patient as well. And we need to be aware that actually some designs, they can be customised to be more appropriate for paediatric areas as well.
Another category of patients who have needs is the plus-size patient group. Evidence shows this group as having multiple risk factors for an increased likelihood of skin damage. These include changes in skin physiology due to a higher skin weight ratio, reduced vascularity, reduced perfusion in adipose tissue, chronic wounds such as venous ulcers and diabetic foot wounds, dietary complications, microclimate challenges due to excessive sweating and heat retention, limited range of movement, including repositioning, heavy abdomen associated with obesity, putting pressure on the patient's legs, occluding capillaries and decreasing oxygen flow to distal tissue. Okay, so back with Debbie. And Debbie, can you talk us through the challenge of reducing these risks?
So for our plus size patients, it's particularly important that we do the right things to prevent pressure over their bony prominences, but of course that can be particularly difficult in this group of patients. Many patients will prefer an upright position rather than the traditional lateral lying position, which is easier to offload from. But that upright sitting position can cause greater pressures on the sacrum, increasing their risk of skin damage. But these are a group of patients with multiple risk factors, and they're actually one of the most important groups of patients where we need to think carefully and work hard to reduce their risk of pressure ulceration.
So, Debbie, from your experience, what solutions are out there? Have you got any practical tips at all?
So one of the first practical things to think about is the weight and width of your patient. Patients may need a wider bed that can manage a higher working load due to their morphology being unsuitable for a standard hospital support surface. Low air loss mattresses are a technology type that can accommodate very high patient weights. A good one could accommodate up to 70 stones, that's 455 kilograms, due to the volume of air that it can pump into its system. Low air loss may also be an ideal choice for a plus-size patient who is struggling with microclimate management, as the tiny laser-cut holes enable a cooling effect underneath the patient, and this can assist with keeping their skin drier and cooler. In contrast, emaciated patients who are less than 40 kilograms are often nursed on fluid immersion simulation mattresses. These systems don't have a minimum patient weight.
So, Debbie, is there any equipment that can help with repositioning?
Absolutely there is. In this patient group, we can be more difficult to reposition patients, and some of the mattresses will come with the turn assist function. There also are some four-way glide sheets where the surface can actually remain underneath the patient to enable patients to be safely moved into an offloading position. Some of them will even work with an overhead hoist to help you get that position. Turning functionality should not be used to replace repositioning, but it can be used to assist the caregiver to reposition. This makes it a suitable choice for the plus-size patients due to the manual handling challenges and can ensure pressure is redistributed and offloaded on a regular basis.
So it's useful to know that suppliers offer an array of different support surface technologies for plus-size patients. Does this mean that we can also offer step-up and step-down management approach for this group of patients?
Absolutely, yes it does. Patients will need different mattresses during their rehabilitation journey. So for instance, our complex patient may begin their journey in a fluid immersion system, and as they improve, we may step down to a low air loss system, and we may be able to step down again to a semi-dynamic system, and step down even further, perhaps to a foam system. And what we're doing here is trying to benefit their recovery by not hindering their mobilisation through the surface that the patient is using.
In this video, we've discussed how support surface is an umbrella term that covers anything a patient is sitting or lying on. We've reflected on the importance of factoring in appropriate cushions and chairs into our approach to optimising skin integrity, and included in our overview dynamic seat cushions as well as riser recliner and tilt-in space chairs. We've also highlighted the technologies that offer pressure redistribution for paediatric and plus-size patients. As is the case with any patient with limited or restricted mobility, our aim must be to prevent deconditioning and immobility. In this series, we have learned that support surfaces are a vital part of that journey, and that it's vital to match the right technology to the right patient at the right time.